Heavy menstrual bleeding is one of the most common complaints that we see for any GYN appointment.
The definition now by ACOG, the College of OBGYN, is really any amount of bleeding that interferes with a woman's quality of life.
I think that amenorrhea is something that physicians have talked about for a long time amongst ourselves because that seemed to be a goal in other ablation device techniques. But when you actually start talking to patients, that's not their goals at all. It's getting their bleeding and their lifestyle back to normal.
Treatment can range from hormonal therapy or medical therapy to hysterectomy.
Many women these days are not keen on using hormones because of the side effects and the perceived risks associated with hormones.
A lot of patients are reluctant to have IUDs put into them.
The only thing that 100% will stop your period is a hysterectomy.
Many people want to avoid hysterectomy. They don't want a major surgery.
One excellent option over the years has always been endometrial ablation. Endometrial ablations as a general intervention really work very nicely. But there are challenges with each of the modalities. We would like to destroy the endometrial cells without having that destructive component.
The Cerene Cryotherapy Device works by using nitrous oxide and instilling that into a very thin membrane that is deployed in the uterus and destroys the endometrium through that freezing effect into the superficial myometrium.
My patients say that it is extremely comfortable. There's mild cramping at worst.
Cold freezes the nerves go numb, the patient feels less.
My patients, after the Cerene Cryotherapy ablation, have seen, in general, a significant improvement in their bleeding. Most within 2 to 3 cycles are noticing, wow, I've had a really dramatic improvement.
A lot of women who come to me specifically because they're having terrible periods. They're either terribly heavy or they're terribly painful. And the Cerene endometrial ablation system really helps with both of those problems.
I think the main difference from Cerene and other technologies that I've used is the uterine access that you have after the procedure. Preserving access to the cavity after an ablation technique or any other procedure is important for patients because as we get older, other things can come up.
For me as a physician, as somebody who cares for patients across the lifespan, so it's not just this one encounter with the patient for this one problem, but that I'm going to be caring for her for years and years and years. Access to the cavity with cryoablation is really a key point for me.
When we're talking about cavity access, there's a good study, the Clarity study, which showed that 96% of patients after a Cerene cryoablation still can have their cavity fully visualized.
I'm encouraged by what my patients say about their symptoms after the procedure. 1 to 2 days out, they're saying they can't even tell they've had anything.
I love the Cerene Cryotherapy Device because my patients love the Cerene Cryotherapy Device.